Hey, it's Dr. Centeno, and I'd like to go over the top 10 things you need to know before the PICL procedure. So the goal of this presentation is to focus your attention on 10 things. Now, there's obviously more than 10 things, but the top 10 things to keep in mind before your procedure. So the first is that everything you need to know beyond what we're going to talk about here is in the post-PICL instructions. Now, usually this gets mailed to you via email before the procedure, and then we give you another copy on the day of the procedure, and oftentimes it gets emailed after the procedure. But make sure you have this document because that's where you want to refer if you've got questions. So right after the procedures, most patients are sore with decreased neck range of motion. That's pretty darn common. Now, that's everything from not sore to very sore with significantly increased symptoms. So just realize that you're probably going to be more sore with decreased range of motion. Your main index symptoms might be increased. So for instance, if your main index symptom is dizziness, it could go up before it gets better. And then the flare-up duration for most people is 3 to 10 days approximately. But for some people, there's very little flare-up. For other people, it's a longer flare-up. As you can see the bell curve there, we even have people that have 3 months of flare-up. It's possible, but uncommon. You can text me, Dr. Centeno, at 303-877-0404. That's in the document that you've been given if you've got a problem. Now, you should only do this if you think you need to go to the emergency room or have a similar type of issue. That might include something like fever, chills, sweats, change in mental state, etc. And if you don't get a response to the text, then you can call. I tend to go to bed early and wake up super early. So just realize, though, that communicating with your doctor after the procedure is reserved for emergencies. Everything else can be handled via email. So if it's not an emergency, but you do have questions, then just send an email to Centeno office at centeno-schultz.com. If you need additional pain medications, please get this sorted out early in the day and don't wait until the evening. We sometimes get patients that figure out they need new medications at 7 p.m. at night. Obviously, there's not usually a lot that can be done at 7 p.m. at night. So try to do this during office hours. We can get you an additional narcotic script if you need it, and that's about 1 in 5 patients will need that. But realize that we do limit access to narcotics because there's a known addiction rate when patients are freely given narcotics post-procedure. Anesthesia, oral narcotics, and sometimes the PICL procedure itself can cause nausea and sometimes even vomiting. So some tips: if you're a cannabis user, THC, CBD, CBN, etc., you're going to require higher doses of anesthesia to stay asleep, and research shows that your cannabis use will cause a rougher post-op recovery. So that's one thing to consider, right? Now, it may be too late to stop this sort of medication that you take. However, you might consider for future procedures going off of it for 1 to 3 months. Same thing will happen with low-dose naltrexone or if you're on narcotics now. Another thing to consider is if you're having a lot of nausea after the procedure, you may want to stop taking your narcotic script and switch to Tylenol. You don't have to take the narcotics. You only need to take them if you've got severe pain, but they can cause quite a bit of nausea. And realize that about 1 in 5 people will come in the next day after the PICL for IV hydration and anti-nausea medications, which can help break the cycle. So if you're in that cycle and you think you're dehydrated because you've not been able to keep anything down, then by all means, contact us. You can come in, we can hydrate you via an IV, give you some anti-nausea medications. You need a caretaker for the first night, preferably a family member who can act as your advocate. If you have nobody traveling with you, then you'll need to hire a nurse. And it's critical that you have assistance when you get up to use the bathroom because falls do happen after patients have been under anesthesia. So you want to get some assistance to go to the bathroom, especially if you're in a strange hotel room, you don't know where the bathroom is, you wake up in the middle of the night, you need someone to assist you. Denver is at 5,400 feet altitude, and we are a very dry climate. So hydrate regularly when you're here in Denver. And again, if you can't keep anything down post-procedure, then about 1 in 5 people come in for a quick IV after the procedure to help hydrate. Prior to and after the procedure, you're going to start with an antiseptic gargle. So that's going to happen today. We're going to spray an anesthetic at the back of your throat. You'll go back to the procedure room, and as you get sedated, you'll have a 3D printed mouthpiece that's going to be placed that'll keep your tongue down and the area that we need to work in at the back of the throat visible. You'll then get put fully to sleep. When you wake up, you'll be headed to or in recovery, and you'll be in recovery for about 60 to 90 minutes and then discharged. As far as anesthesia is concerned, don't drink anything for about 2 hours prior to the procedure, and you can't have anything to eat for 6 hours prior to any procedure where anesthesia is being used. So this is just double checking that you understand all of that. And then your doctor will tell you when you can begin rehab and strengthening. This is a common question I get. Usually that's these post-PICL exercises for CCI patients that we have online. But you do need to reach out to your doctor. Usually we're not going to start these until symptoms go down. So that's pretty much it. Thanks so much for watching. And again, remember everything you need to know is in the post-PICL instructions. Please make sure you have this document. It's, dozen or more pages long. It's all in there. Every little question that you've got has an answer in there. We've taken a lot of time and care in putting that document together. Thanks so much. Have a great day.